Om Swastiastu, we are from Group B6 and we will present our student project about gender dysphoria. I'm Angelica Fatmalangawan as the moderator with the last 3 student registration digit number 092. Here are our group members. Now we will present the introduction. To the first presenter in charge, you may start.
Greetings, my name is Gabrielle from Bursa Vita with my last 3 digits number 118, and today I'll be presenting about the background of our student project. Since birth, men and women are significantly different based on their genital anatomy and chromosomes. Biologically, men were born with penis and testicles while women with vagina. These biological characteristics are defined as sex. Sex and gender are often used interchangeably, when in fact, sex is more directed to a person's biological characters, meanwhile gender refers to the feelings, roles, and social expectations associated with being a man, woman, or other gender identity. Gender identity is how a person identifies himself internally. Some identify as men and some identify as women, and this so-called cisgender. However, not all individuals succeed in identifying their gender status correctly. This condition is known as gender dysphoria. The term gender dysphoria was first recognized as transsexualism in DSM-3, which referred to the inappropriateness of one's biological sex alongside to the wish to be rid of one's genitals. And this began to change in DSM-4 as gender identity disorder and currently known as gender dysphoria in DSM-5. Gender dysphoria is an understanding that refers to people who present their gender differently from the ideal due to the feelings of discomfort with their own gender. Includes identities as trans man, trans woman, monkey woman, or people who cross-dress. Gender dysphoria has been recognized as a medical condition in DSM-5. However, this recognition does not categorize gender dysphoria as a mental disorder, but rather as a medical condition that requires clinical attention and support that is sensitive to the gender identity of the individuals concerned. I think that would be all from me. Thank you.
The problem formulation of this paper is what is the definition of gender dysphoria, what are the epidemiology, etiology, and pathophysiology of gender dysphoria, what is the diagnosis of gender dysphoria, and what are the treatment and management of gender dysphoria. The objective of this paper is to know the definition of gender dysphoria, to know the epidemiology, etiology, and pathophysiology of gender dysphoria, to know the diagnosis of gender dysphoria, and to know the treatment and management of gender dysphoria. The first benefits of this paper is theoretical benefits, that this paper can be used to increase knowledge about gender dysphoria, its epidemiology, etiology, and pathophysiology. In addition, it can be added insight about the diagnosis, treatment, and management of gender dysphoria theoretically. Second benefit of this paper is practical benefits. Practical benefits for reader are being resources of information and references regarding gender dysphoria, its epidemiology, etiology, and pathophysiology. Practical benefit for the writers is to increase the experience and knowledge of the writer in writing scientific words, and for academic institution, practical benefits for academic institution can be used as a reference for academic institution to develop knowledge about gender dysphoria, its diagnosis, treatment, and also management.
Okay, let's talk about definitions. The word gender derives from an old French word genre, which signified sort or kind. Sex and gender are often used interchangeably, although they are very different things. Biological sex refers to categorization of a person as a male or female based on their chromosome and their genitalia. Sex is assigned to a person at birth. On the other hand, gender is more abstract to define. Gender is how a person identifies themselves, how they fit with norms, attributes, and activities, which are commonly associated with men and women. So most people has congruent sex and gender, but for some individuals, there is an imbalance between their physical makeup and how they see themselves. So gender dysphoria is defined at DSM-5 as a marked incongruence between their experience or expressed gender and the one they were assigned to at birth. This has more to do with individuals' sexual identity rather than their sexual orientation.
The prevalence of individuals with gender dysphoria greatly varies in every age. In children and teenagers, the prevalence are in the range of 1.2 to 2.7%. About 0.5 to 1.3% report to themselves as a transgender, distributed among children, teenagers, and adults. According to the DSM-5, the prevalence of individuals with gender dysphoria are in the range of 0.005 to 0.014% for males and 0.002 to 0.003% for females. The gender ratio between males and females with gender dysphoria has been shifting over years, from 2.111 to 1.176. The number of individuals seeking help from clinical gender service kept on increasing. There was also a significant increase in the number of individuals seeking reassignment surgery, approximately 80% per year. Individuals with gender dysphoria are found having substance use problems, suicidal thoughts, anxiety, depression, and personality disorder. The prevalence globally varies in each region due to diversity of cultural acceptance, norm, and stigma about gender dysphoria.
Hi, my name is Putri Nadia Nandita Prasanti, and I'd like to explain the cause of gender dysphoria. The underlying factors behind gender dysphoria remain not completely understood. However, it's likely that a combination of psychosocial and biological factors may underlie the development of gender dysphoria. The first one is biological factors. Gender dysphoria is frequently associated with prenatal stress, infection, genetics, and hormonal disorders. Research link gene expression and brain structure to transsexualism and sexual behavior. There is a theory that suggests sex hormones, particularly testosterone and estrogen, may play a role in gender dysphoria. Testosterone can increase sexual desire and aggression in women, while estrogen can diminish sexual desire and aggression in men. Low testosterone levels in male fetus are linked to an increased incidence of gender dysphoria, and gender dysphoria is believed to be more influenced by postnatal development than prenatal hormones. And the second one is psychosocial factors. Gender identity in children is typically formed based on their biological sex and is influenced by their characteristic and parental behaviors. In societal norms, there exists a gender bias that expects boys not to act feminine and girls not to act masculine. The quality of parent-child relationship, especially during the first year of life, is crucial in shaping gender identity. Mothers are expected to provide nurturing support to instill gender pride, while harsh treatment or absence may lead to gender identity issues. And fathers serve as role models for their daughters and help boys understand the concept of masculinity.
Hi, my name is Sarah Putri Bungaran with 078 as the last three digits of my student number. This time I'll talk about the pathophysiology of gender dysphoria, especially in biological factors. So when we talk about the brain structure of individual with gender dysphoria, an individual who perceives themselves to be a different gender than their biological sex is hypothesized to have the same brain size as their perceived gender. And focusing on the brain structure of individual with gender dysphoria, mainly on their cortex volume, smaller gray matter in the left primary somatosensory and motor cortex is found in females and male to female gender dysphoric individuals. And research conducted on transgender adults found that the hypothalamic response is more similar to their perceived sex than biological sex in individuals with gender dysphoria. And when we talk about the heredity and genetic, no specific gene has been identified as being responsible for the emergence of gender dysphoria yet, and the CYP17 gene, which regulates the amount of sex hormone generated, contains a mutant allele A1 that is more prevalent in transgender men. And when we're focusing on androgen insensitivity syndrome as a factor in gender dysphoria, AIS results from mutation in the AR gene that prevent androgens from acting on tissue that are present during and after pregnancy. As a result, despite expressing a female phenotypic, these people are genetically male. An individual with complete androgen insensitivity syndrome would show clinically as phenotypically female from birth with normal serum levels of male androgen. And depending on the person's genital reaction to androgens, partial androgen insensitivity syndrome may manifest clinically in different ways. Despite having an XY genetic constitution, these people are raised as girls and conform to social responsibility that are often associated with women. Although the female sex is the typical or default path of prenatal development from a biological standpoint, this is frequently not the case after birth, where societal influence and expectation can play a very large part in the development of gender identity. Gender identity development is thought to be influenced by increasing androgen expression in the brain. So that is for me. Thanks for your attention. And the next will continue by my colleague. Thank you.
The psychosocial factors of gender dysphoria. The first one is sexual abuse. The prevalence of a wide range of psychosocial and interpersonal issues is higher in those who are or have experienced sexual abuse. The findings indicated that many persons had a story of maltreatment as children. Hence, neglect and abuse as a child can result in gender dysphoria. Second one is discrimination. People of different genders experience discriminations, aggregations, rejection, or victimizations. It causes more suffering and has a detrimental effect on their mental health, can also cause gender dysphoria. The third one is discomfort feeling. How differently teenagers express their gender, how much they have outed themselves to others, or how much they live according to their preferred gender role make the person feeling discomfort. And the last one is parenting. Parents also played a significant role in the normal development and learning of gender practices, so that one's parents' absence disturbs the normal process of sexual behavior in children.
According to DSM-5, the APA changes the diagnosis GID to gender dysphoria or GD by the code of 302.85. This can be classified into four main groups. For the first main group, adolescent and adults, the incongruence of one's assigned gender biologically and one's expressed gender must occur at least for 6 months, as manifested by at least 2 out of 6 symptoms pointed out. This also applies in children, but with 2 out of 8 symptoms pointed out. In addition, we need to take account of whether the condition is associated with clinically significant distress or impairment in school, social, or other important areas of functioning. The diagnosis of other specified gender dysphoria is for those who do not meet the full criteria for GD, yet still experiencing symptoms of GD that cause clinically significant distress. On the other hand, those who do not meet the full criteria of GD, which is due to insufficient information for a specific diagnosis, should be classified as unspecified gender dysphoria.
First of all, let me introduce myself. My name is Devalin Ramadan with TRILAS number 016. In this opportunity, I will tell you about treatment and management about gender dysphoria. Effective treatment and management strategies are crucial to alleviate distress and improve the overall well-being of those affected by gender dysphoria. The treatments can be divided into 2 main categories, including psychological support and medical treatment. Psychological support for gender dysphoria is a vital component of care that focuses on the emotional mental well-being of individuals experiencing these conditions. It encompasses a range of therapeutic approaches and interventions provided by mental health professionals, including psychologists, counselors, and therapists who specialize in understanding and addressing the unique challenges faced by transgender and gender non-conforming individuals. Effective psychological support for gender dysphoria should involve several key components. First, it should provide a safe and affirming space where individuals can openly explore and express their gender identity without judgment. Moreover, support should include strategies to help individuals cope with the emotional distress often associated with gender dysphoria, including anxiety and depression. In the end, fostering connection through support groups and providing access to educational research about gender diversity can contribute to a more comprehensive and empowering psychological support system.
The treatment of gender dysphoria can be followed by medical treatment, which individualize and depend on the patient's identity, needs, and preferences. Several medical treatment options for gender dysphoria, such as pubertal suppressions, which is treatment options for gender dysphoria in adolescents. Pubertal suppressions is implemented using the gonadotropin-releasing hormones analog at standard 2 or 3 stage of puberty. The use of long-acting gonadotropin-releasing analog gonadotropin suppressors to prevent puberty progression. The second one is gender-affirming hormonal treatment, which is used the synthetic sex steroid to stimulate the development of sexual traits of the identified gender. And the third one is surgical intervention, which is the goal of the surgery is to establish greater congruence with the experienced gender by addressing primary or secondary sex characteristic.
So after all, this is the conclusion. Medical disorder according to person's experience in being female or male is called as gender dysphoria, resulting from a perceived gap between the physical appearance and how they see themselves. Gender dysphoria varies in age, sometimes inflict mental disorders, and recently known to occur more in males. Although the base factors are still unknown, gender dysphoria can be influenced by biological factors such as prenatal and postnatal development, genetic and hormonal disorders, or other medical condition, and psychosocial factors such as individual interaction with their environment. Also, other than the gray matter of cortex volume, distorted body image because of biological factors comes from the neuronal process that involves sex hormones, or also genes, such as by hypothalamic response, CYP17 gene, and androgen. Meanwhile, abuse and poor social environment are the psychosocial factors. Gender dysphoria can be diagnosed after 6 months of onset, has its own diagnostic requirements according to its manifestation and category, and rehabilitated through psychological support, including teaching coping mechanisms, building resilience, and addressing negative thoughts, or through medical treatment, including pubertal suppression, gender-affirming hormonal treatment, or surgical intervention. Since the underlying factors are uncertain, various reviews and studies can be used as tools to find answers. Interconnections can be taken for further research. With renewed thinking, gender dysphoria may have a higher probability to be treated, even prevented. By that, hope arises, expecting that this will give people a sense of comfort in being themselves and being completely healthy in the aspect of physical, mental, and social.
Okay, we have come to the end of our group presentation. Thank you for the attention. Para Santi, Om Santi Santi Santi.